Hi everyone, my name is Perello-Depaz. I'm a graduate student in Dr. Frederick's class. This is Psychology 5323, Counseling and Psychotherapy. This is my narrated counseling session on ABA therapy and person-centered therapy. If you click on the following link, you will be able to see my full video. I decided to do my two techniques in two separate sessions. The first session includes the AB therapy responsive cost technique, which is a session with a parent of a 6-year-old who was having difficulty regulating their emotions, keeping their hands to themselves, and listening. And then the second session that I had was with a 17-year-old girl who was struggling at school and at home, and the parents are concerned for their overall health. And so they reached out to the therapist. In the first session, I used the ABA therapy response cost technique, which is developed within the framework of behavioral psychology. Particularly, it was influenced by B.F. Skinner's work on operant conditioning. It is widely applied in educational and therapeutic settings by behavioral psychologists. The response cost is a behavior management technique where a valued item or privilege is taken away when a child has an undesirable behavior. It is very beneficial to use in school settings because it helps students learn accountability and encourages positive behavior through those consistent and clear expectations. And as you can see through the visual, when you are using this technique, you want to identify a reward, set clear expectations, use a visual chart, implement that response cost, be consistent, praise the student, that client for that positive behavior, but also explain those consequences in a manner that is child friendly and can be also understood with the student. In my video, you will see that I demonstrate at 25 seconds into the video. I discuss the concern of behavior and I introduce techniques to support at home. At 42 seconds of the video, I introduce this response cost technique, which is used. I give more explanation of the method. Then at 2 minutes, I share the visual as well and I explain in depth. I identify the cycle of the setting expectations using the visuals. And as you can see here on this visual, I've included a chart where it's recommended to visually track that positive behavior and those earned rewards. It's tailored to that specific need of the child. I implement that cost response, which is, pretty much defining why that reward is earned like a sticker and if it's taken away because that child is engaging in those unwanted behaviors. In my video at 4 minutes and 45 seconds, you will see that I address and answer any questions that the parent is having. I give more detail on the emphasis of being consistent with the technique. I praise that positive behavior. I also give examples of how to explain consequences, again, in a child-friendly manner. And then at 6:40, I remind the parent of the importance of being consistent in such a method when we're applying it. My second example of the technique that I chose was through the person-centered therapy, which is a therapy technique that was developed within the framework of Carl Rogers. It has a humanistic approach that emphasizes empathy, unconditional positive regard, um, and the therapist's genuine presence is there. This technique fosters a non-judgmental environment to empower individuals, and also it follows this framework of helping that client achieve that self-actualization in a non-directive manner. So what this pretty much means is that the client leads the session, even though the therapist is there to support the client's journey. In this specific session in my video, you will see that I, as a therapist, demonstrate the Carl Rogers approach using congruence, genuineness, empathy, and unconditional positive regard. In the session, I helped my client access their own capacity for growth and that self healing, and I fostered a safe, non judgmental environment where they felt empowered to explore and resolve their own challenges. So, if you watch my video, from the beginning, I express empathy by welcoming my patient. At around 8 minutes, and 8 minutes and 36 seconds, I also again demonstrate empathy for my client. At 13 minutes and 31 seconds and 14 minutes of 5 seconds, I demonstrate that congruence, that genuineness, support for that authenticity and realness when my client is talking. I demonstrate unconditional positive regard at 8 minutes and 36 seconds, as well as 9 minutes and 25 seconds, where I show no non-judgmental acceptance, but I do give that support. This is also visible at 10 minutes and 51 seconds and at 15 minutes and 13 seconds. I then move on to showing the client's ability to move forward, and you can see that at 18 minutes and 52 seconds in the video. And then I also demonstrate that strong therapist-client relationship at 16 minutes and 37 seconds. There are also examples of non-directive dialogue occurring at 15 minutes and 50 seconds and 17 minutes and 8 seconds. And then lastly, there is that self-actualization, which is part of this technique, and that occurs at 18 minutes and 25 seconds. I created the video as a counselor student, and I found this kind of to be challenging but rewarding at the same time. It pushed me to step out of my boundaries and into that professional role where I was practicing and conveying empathy and active listening while on camera. Um, as a student, this made me more aware of my communication style, and I highlighted areas where I need to improve, such as like pacing myself, body language, and maybe providing a clearer picture for summaries when I'm listening to my patients and providing that mirroring or that self reflection. By being a client in the therapy session with my partner, I also found that as kind of a vulnerable but insightful opportunity. It allowed me to experience that therapeutic process from the other side, and it helped me to better understand the importance of feeling heard and valued and the impact that a counselor's presence can really have on someone. So in conclusion, this assignment and learning how to use these two different techniques was very beneficial. Using the ABA technique, which is a response along with the person centered therapy, was beneficial. It proved a balanced approach to behavior management and emotional support. It helped me to understand how to set clear, consistent boundaries while fostering a safe, empathetic environment and skills that are essential for working effectively with students in school settings. That is my goal. I want to be a licensed school psychologist. And so I know that, having the preparation and the right tools with combining such techniques will allow myself and future therapists to address both those behavioral and emotional goals holistically when we are working with our students. Below are listed my references. Thank you for your time. Have a wonderful evening.